Good morning, everyone. I'm Megan Cullup, along here with Scott Micklin.
Hello, everybody. And you are here for our COVID-19 local information program. Today is Monday, April 20th, and we're glad that you're with us.
That's right, Monday.
We made it to another Monday.
We did.
Yay.
It's impressive every time.
Go, everybody.
Yeah.
But we appreciate you being with us, everyone. This is our chance to get together as a kind of a radio community, an online community, and just share what's been going on, what's been happening, and how people are feeling. Get some updates from some local folks in the know, and that's the whole point of the show.
In the know.
Yeah.
Isn't that our new slogan right now?
Sure.
Information when you need it, music when you don't?
That too.
Yeah.
Yeah. We're developing it.
That's right. So right now we need it.
We sent that out to
a person
yeah,
who does the thing?
to a committee. Committee's on it.
Oh, I know about committees being on things.
Bet
yeah.
you do. Yeah.
Yes.
So anyway, we're glad that you're with us, everybody. We are going to be hearing in just a few moments from Jeff Bourgeois, the CEO from San Juan Regional Medical Center. He'll be calling in again to give us an update, and we could talk about some other things, though, that happened over the weekend.
Right.
In the meantime.
Let's do that. You want to pull up the dashboard?
I will pull up some numbers here in just a second, but I'm going to make you talk about something first while I do that.
Yeah, so it's distressing news, unfortunately, but don't worry. We end the show with a positive. So we'll begin with the distressing. When it comes to COVID-19 cases on the Navajo Nation, there have now been more confirmed tested positive cases than 48 states in the United States, and more deaths of COVID-19 on the Navajo Nation than 13 states.
Right.
So when you put it, it's already, the numbers were already distressing and shocking, but when you put it like that, it's I feel like it's a whole nother level of like, what?
Right.
Yeah.
That's true. And that's why there's been so much concern from the states and around the Navajo Nation and the Navajo Nation themselves, and why we've seen the 57-hour weekend curfews set into place. And again, that will be happening again this weekend, everybody, just because to try to get a handle on this and get more testing out to just see maybe where these hotspots are and how it's spreading and those types of things. So that's where we are.
That is where we're are, and that's...
But we take a look at the numbers from the state, and there was an issue with yesterday's numbers. They weren't getting all the numbers in from all the labs, so they were getting that little asterisk that said, these may change, or there may be more on Monday. But we'll see. So we had another 47 cases in New Mexico, another 15 here in San Juan County, so we're at 275. And
in the county,
2 more deaths, and that included 1 more death here, reported on Sunday, and recoveries were up by 22. So that's the numbers today. And again, we share these with you, not just to bum you out, but also just to kind of watch for when these numbers start to kind of calm down, and maybe they're not double digits, which would be a great thing, and that would maybe tell us that maybe
an amazing thing.
Things are starting to calm down. And so that's why we like to at least go over these every day. The daily statistics are there. The Navajo Nation's numbers are there. Again, they're at 70 new cases, no more deaths one day.
70 new cases. So have we done the math on how many average per day new cases we get? We should do that.
No, we haven't done that.
Let's do that math.
All right.
I can't do it in my head right now.
No,
I'm not
skilled.
Not skilled.
But we will.
But we'll get that for you.
Everybody.
Yeah, we'll work on that. I would love to ask whenever we get whoever from the state health department.
Yes, we're working on that.
To call in.
Yes.
The lag time.
They're on notice.
What the lag time is between
of the tests and the results.
Yeah, right. So are the numbers ever super up to date actually? Or are they always a couple weeks behind?
I think as the testing gets better, but we're going to ask. That's a great question because nobody wants to go off of what I think. But we may ask that question to maybe Jeff Bourgeois may know.
He might know.
Or our doctors who will be talking with.
I plan on asking both of them. Is that cool?
So I think you could.
Cool.
I think you could indeed. Cool. You asked about the dashboard, and this is again from the New Mexico Department of Health. They have put on this dashboard now for the state. And they actually, and we've shared this before, everybody, this is from the New Mexico Department of Health website, and you can see our state, and of course the most cases are the counties in red, and that's why that northwest corner is so...
That would be us.
Yeah.
Yeah.
kind of scary looking, right? So, but it goes all the way down to Bernalillo, which is Albuquerque, of course, Sandoval County, McKinley County, and San Juan County. Those are those red counties that you see. It also gives you information about the age breakdown of cases, the gender breakdown of cases, as you kind of scroll around. The new thing, though, was you can look by zip code, Megan.
Oh, okay, that's huge. People have been asking me that, actually, specifically on
so
zip codes.
you can look at the map by zip code. And if we go to San Juan County, let's see if I can do this while I'm talking. This is multitasking, everybody.
This is tough. Well, and I'm looking at the age breakdown right now.
Right.
And still
again another lots of ages,
super
right?
Super interesting. Well, so 30 to 39 and 40 to 49, that's still the highest infection rate as far as positive tests.
Right.
Not death, but positive cases, which I think is notable.
Right.
Very notable.
I'm going to the two Farmington zip codes here, 87401.
Okay.
And then we have 60 cases in zip code 87401.
Okay.
Okay. And so there's that. And then if we go to 87402, which is a smaller geographic area, 11.
Okay.
Right? But you can see kind of how that works. We can also look at maybe some of the other areas that surround us. Aztec, 10. So you click around on there.
Right,
everybody.
yeah, that's
we won't
really
do
interesting.
it on the show. That's going to be great radio for our radio listeners
They're
later
gonna love
this
that.
afternoon.
They're going to love all that dead air while we're working on the
while
computer.
Scott's clicking.
Great. Should have thought about that. All right.
That's okay. That's all right. But we invite you, if you're listening to this on the radio, you can go watch the video on Facebook or YouTube and kind of see what we're talking about.
See what we're talking about.
But,
go on the dashboard. Follow us along.
There you go. But we've got it from our website, ksje.com. Look under news. We have all the COVID-19 stories, and that's how we're getting to this site. It's just a couple of clicks, or do a search, and you can get there too.
Right.
So, but there you go.
Very interesting.
Yeah, very much so. So, but that's the latest. So the state did add that. And I think they're trying to get more information out, about the tests, maybe about the lags, time, and all that stuff that you're asking about. So we do appreciate.
I'm very interested in the testing.
Right.
I also heard a lot of interesting things about the radius thing. So we've been saying 6 feet away.
Right.
Right? So there's all sorts of backstories there that are fascinating. Like when they started testing for this was in the 1930s, where they were trying to test how far does the flu travel, how far does the cold travel. Anyway,
okay, right.
I see we have a caller, so
we do.
We'll go back to that because it's fascinating stuff.
That's all right. You can now see the phone, and we can see that we have a caller. Good morning. You're on KSJE.
Hi, Scott. Jeff Bourgeois here. How are you today?
Hello, Mr. Bourgeois. We're fine. Jeff Bourgeois, of course, CEO from San Juan Regional Medical Center. We appreciate you calling in to give us an update on how things are going at the hospital. Why don't we? I think we should start there with you. How are things today after the weekend?
Well, pretty steady for us over the weekend in terms of our overall activity, both for non-COVID as well as COVID patients. As of this morning, we have a total of 109 patients in-house. 17 of those are COVID-positive patients, and we have another 28 that we're pending test results on. And just some other general activity going on elsewhere.
Right.
Hospital, just routine illness, et cetera.
Okay. Is that pretty... Is that about where cases have been, Jeff Bourgeois, or is this a little bit of an upswing or a downswing, or are these numbers too small, you really don't want to average them out, I guess?
Well, I would say that last week, in general, was a little busier than the prior week across the board for both COVID and non-COVID patients. Probably the week prior, we were trending just under 100 or so daily census, and now we're seeing that we've been in the 100 to 109 range most of last week, and that's where we're starting this week. So a little busier.
Okay. All right. And I know, go ahead, Megan.
Well, I was going to mention your level of we've been talking about how prepared you guys are, and you're not in this desperate, panicked state because currently you have enough staff and protective gear and stuff like that. And so I'm always wondering about where the nexus is of prediction and preparation and where you guys are at with that.
What do you mean by where the nexus is, Megan?
So, great.
I was stumped too,
question.
Jeff, on that one. I'm sorry, I couldn't help.
Sorry, guys.
At all.
Sorry, gents. Well, to me, there's a difference between we're predicting this crazy big number, or we're just making sure we're double prepared for it.
You mean the surge that we keep talking about?
Right,
Is that
exactly.
Okay.
Yeah.
So, Jeff, does that help?
It does very much. I'm expecting some updated numbers from the Central Medical Advisory Team that is working with the Department of Health and Human Services Department today. I don't have those yet. Overall, on a statewide basis, I still believe, statistically speaking, the state is expecting its peak in early May. What we're seeing in the northwest corner of the state, particularly San Juan County and McKinley counties, that surge is happening earlier. So if you watch the Albuquerque media or look at the Department of Health's website with respect to their coronavirus updates, you'll see that I think we have 275 positive cases in our county.
Yes.
McKinley is quite a bit more. That's essentially Gallup.
And they have a smaller population, so that is significant, I think.
They do. There's been some real hot spots in different parts. It's really interesting if you went into the zip code tracking capability on the Department of Health website, you'll see on a zip code by zip code basis where the concentration of patients are.
Yeah, we just looked at that before you called, Jeff Bourgeois. So we were looking at the Farmington zip codes, but you're right. You can certainly tap around and kind of see. We certainly saw all the big red counties in the northwest corner of the state, which is why folks are so concerned, certainly for you and your staff and how the hospital is faring with these numbers that we're hearing about.
Yeah. So we're entering you call it the middle of the third week or so in April, and if all the modeling is correct, and the northwest corner would surge and peak sooner than the statistical model for the whole state, we're watching the next 2 weeks very closely. They should be very informative to us about how this is all going in terms of, are we near the peak of our curves, so to speak, here in San Juan County?
Right.
But
okay.
The team, our teams everywhere, with respect to those on the fourth floor caring for the COVID patients, those helping us stay prepared, and those that are taking care of other non-COVID patients are all doing very well. It's a challenging time. There's a lot of uncertainty, and given that this is the first time hospitals anywhere have seen this type of change in their operations and in a novel disease, that I think that the entire healthcare community is learning how to best treat.
Certainly. Well, and it seems to me, Jeff Bourgeois, things are changing hour by hour, day by day, minute by minute almost, really, as to the numbers and some of the recommendations. We have seen things about social distancing and physical distancing. At first we thought maybe masks weren't maybe necessary, but now we hear that they maybe are more necessary, especially when we're going out to the grocery store or things like that, and some of these other recommendations that are evolving as I think the scientists and the folks looking into this learn more about this virus, because it is novel, it is new, and it doesn't really act like a lot of viruses we've dealt with before. In other ways it does, but in lots of ways it does not. Is that from a non-medical guy, but to you, is that what you're hearing as well?
Well, we know how it's spread through droplets, the respiratory droplets in people's breaths, making contact with a hard surface or actually being inhaled by someone else. What we do want to stress is that while these public health orders that our state has put in place are really changing our way of life, and they're painful. The social distancing, the isolation, the essential services only. We do know that those are tried and true public health measures, and they can reduce the rate of disease transmission in a community, and it's important that we respect those. So I want to encourage all your listeners, Scott and Megan, to really pay attention to those. We would encourage wearing a mask if you are going out in public. We have that rule in place here at the hospital, as we even outside of our COVID areas, that if you're going outside your immediate office and going to have interactions with others within a 6-foot distance, that you're certainly wearing your mask. And then I'll wear a mask, for instance, if I need to go to the grocery store.
Exactly.
So those are really effective, and it's to help us protect one another from what we can't see and what we don't know. One of the things that is really, you mentioned the novel virus, and some of the things we don't know is how many people are actually carrying the virus and just truly asymptomatic. So while you may feel fine, you may still be a carrier, and you want to protect those around you or those you might come in contact with. So to take heed of the guidance that is out there regarding social distancing and hand washing and wearing masks, et cetera, is something we want to strongly encourage.
Great. I kind of speaking to the spreading and the respiratory droplets, which Scott and I are both squeamish about that phrase. But you had mentioned that the COVID floor is the 4th floor. So is staff, I'm assuming just because, it's just essential staff to this situation, moving between floors a lot? Is there like extra precautions taken there, cleaning staff moving between floors and stuff like that? Can you speak to that?
Well, we certainly make sure the staff have PPE and know how to use it when they're up on the 4th floor. Part of what we've done in preparation for a surge is we've floated some other staff, particularly nursing staff, up to that floor if they so they can get experience on how to properly don and doff the PPE and the care, kind of the clinical care regimens that are being ordered by physicians to care for these patients. So, and then certainly for cleaning staff, if they have to go up there, and clean a room, they follow all the same requirements with respect to PPE.
Great.
Very good. And Jeff Bourgeois, you were mentioning too, I know that the hospital is still open for other types of care, although we heard that the hospital, of course, had to do some furloughs a week or so ago. But I guess if folks are coming to the hospital for other types of care, would that mean the demand would increase, and maybe some of these folks would be called back into work if the demand increases for other types of care? And can you talk a little bit about that with us?
Sure. What we want to make sure people do, Scott, is if you have an emergent medical condition, please come to the hospital. Call 911 if you feel it's necessary, but people with heart attacks, stroke-like symptoms, or other emergent medical conditions may be a little concerned about coming to the hospital right now, and we want to make sure that the public knows that we've actually segregated our emergency department to have a respiratory illness side to it, if you will, and a non-respiratory illness, so we can keep the patient population separate. And you cannot, we would strongly ask that people do not avoid coming to the hospital if they feel they have an emergent condition. It's important that they get the care they need. We are still here and still more than able to address those emergent medical conditions that are completely non-related to COVID. So, accidents still happen in the community, injuries still happen, heart attacks and strokes still happen, babies still get born. So we want to make sure people are aware of that and come to the hospital if they have that kind of need.
And Jeff Bourgeois, are you aware of anyone maybe that delayed coming to the hospital, maybe because of some misinformation or something? I mean, it seems like just a no-brainer to me that if I have chest pains, I'm going to call 911 and get to the hospital.
Yeah, Scott, I've heard one anecdotal account about that. I don't know the details. And
okay.
That's what really.
I don't want to break a HIPAA rule, so I understand.
Yeah.
Yes.
But that's what prompted me to really want to mention that this morning. And we've had some social media posts out there on our Facebook account, just reminding people that we're open and available to meet your emergent and urgent medical care needs. So,
well, that's good to know and a good reminder, I think, and again to explain how kind of segregated the patient populations are at the hospital during these times, and it's probably not that much different than what you would do during a really bad flu season either, right? We've heard that when the emergency department maybe gets segregated a little bit too, right? Same type of thing.
Right, and exactly, Scott. And going back to the novel nature of this virus and the fact that it's probably going to be with us well past our surge and our peak, until such time as there's a vaccination available, the hospitals everywhere are going to have to learn how to adjust their operations to provide care for all, as well as be mindful of those that might have what we call influenza-like illness, ILI. So that could be, anything from a bad cold to a flu to RSV to actually COVID, and make sure that we take the proper precautions to prevent spread of those types of viruses amongst patients. And we've got a solid process in our ED that then goes forward throughout the hospital to make sure we take the proper steps to protect not only the patients but everyone else in the organization.
Yeah, so I have one more question. So we're hearing reports that in other areas of the country and states that there are folks that might be dying in isolation, and so I'm wondering, is that happening in our hospital? Is there something that could be done about that? I know that some of the assumptions is that we got to protect the PPE for other cases, but so can you speak to that?
Yes, this is one of probably the toughest things emotionally for families who have a dying family member in any hospital with COVID, is the visitor restriction policies that are stood up across our country. We've done that here, and we've let clergy in for last rites, and of course we encourage phone and Skype and FaceTime type visits, and we only allow one visitor per patient in a very limited number of circumstances. So we're working with patients and families on a case-by-case basis, but certainly all over the country, there are times when family members are saying goodbye to their loved ones via some sort of electronic media, whether it be Skype, FaceTime, or phone, and it's probably one of the most difficult things around this illness that I think any of us have to deal with, particularly those, frontline caregivers, our nurses who are up there in the patient room with the patient and having to, sometimes be the intermediary between a patient and a family member. That's emotionally difficult, and we should all just all have an immense amount of respect for those frontline caregivers who are dealing not only with the clinical and physical challenges of treating these patients, but also the emotional challenges. And it takes a special type of person to do that, and we're blessed to have a hospital full of them.
Well, that's very true, Jeff Bourgeois. And again, our thoughts go out to all your folks that are there on the front lines and all those caregivers who are doing these very things you describe. And I just can't imagine some of those scenes that are going on in your hospital and hospitals throughout the country and the world with what's going on. So we always appreciate your time and talking to us about the updates and giving us good local information. Jeff Bourgeois says thank you for joining us today.
My pleasure, Scott and Megan. Thanks for having me on this weekly spot, and I'm happy to do so as long as we need to feel, or we feel we need to keep information getting out to our community timely.
Understood, and we appreciate your availability, and don't take this the wrong way, but we hope we don't have to talk to you for too many more weeks. How's that?
Hey, I'd be all for that, Scott. We could find something else
different to talk about. Yeah,
there you go.
Yeah,
that's what I look forward to. How's that?
Yeah.
Don't lose my number.
Wonderful.
Okay.
All right.
Thank
guys
you.
Have a great day.
Thank you, Jeff Bourgeois, CEO, Salem Regional Medical Center. This is why I'm not a doctor. I have no bedside manner at all. I don't.
Seriously.
I really don't.
I know.
Yeah.
We look forward to never seeing you again.
I didn't say it that way. It really, come on. I tried to
respiratory droplets.
filter
I saw
bit.
like almost like puke response there.
No, that was just a little very
respiratory
that was
droplets.
very descriptive.
Well,
You know,
they have to be descriptive. We got to be precise.
Well, he hit the
Health
nail
is on the line.
on the wet head on that one.
Oh,
It was-
God.
Yeah, exactly. We have another call.
Oh, that's good.
Yeah.
We should take
think
that.
It is.
We should take that.
We should. Good morning. You're on KSJE.
Good morning, Scott. This is Liesl Dees.
Liesl Dees.
Hey.
Welcome, Liesl. Great to hear your voice.
Thank you. Good. Happy Monday morning. Did you have a good weekend?
Thank you. Yes, I did. I did, Megan.
Yeah.
I can't speak for Megan, but I did. Apparently we both did.
Excellent.
And you?
I did. I did a virtual art walk on Friday night, and I did social distancing bike riding on Saturday, and I listened to Megan's show on Saturday morning. I even taught my parents how to listen in from Florida. Just saying.
Well,
Yes.
thank you for that. That is
I love
very
hearing
nice.
about interstate fans.
There you are. Wonderful. Well, wonderful. That's great, and thank you for singing the praises of KSGE to your parents. We appreciate that.
Well, you're welcome. Getting fans across the world. Yeah.
There you go.
That's right.
Yeah. Agreed. I agree on that one.
Well, wonderful. Well, what brings you to the show today? I think I know.
Well,
We know, but you tell us.
yes. So my role at San Juan College is that I direct the Community Learning Center, and we oversee a program called the Volunteer Center. So when COVID-19 was kicking up, people around the county began to say, okay, we've got a great community where people want to help. How can we help make that happen? So the city, the county, City of Farmington, the San Juan County, San Juan College, and the United Way all partnered together to create a want to help line. So we know that there's a lot of need in the community, and for people who are looking for resources for the needs that they are having in these unprecedented times, the United Way has already had a 211 helpline. So encouraging people, if they have needs that they're trying to figure out, okay, what are the resources within the county that I don't know exist, that 211 helpline is the place to go if you're looking for help. If you want to help others, because maybe you've got a little more time than you've ever had before, maybe your heart breaks every time you turn on the news, we've got a want to help line for people who are looking for ways to help others in the community.
Great. And these are ways that we can maybe help without maybe, again, by still complying with social distancing and physical distancing and all of that, but these are other ways that folks can maybe help out a number of these nonprofits and other organizations in the community, right?
Exactly. And so it's things that would follow social distancing or that are essential services that are needed right now. And we started thinking in terms of volunteering, but some of our ways to help in this time is are not maybe what you would think of as traditional volunteering. Who knew that your sewing machine could be such an asset in this time, and that the mask makers would be kind of true warriors in this time?
Mm-hmm. No kidding. That's
example,
true. Right. Perfect. So we can go ahead.
Well, I was going to say, Scott and I, another plug for you all is that one of the ways that we've been finding out some of the things that are happening in the community around this is listening to KSJ.
Hey!
Well, that's great.
Yeah.
Perfect.
Hearing what needs are.
Mm-hmm.
We love feeling relevant.
We do.
I perhaps more than Scott.
usual.
More, yeah.
That's right.
Yeah.
There you go.
But that's wonderful. Well, we're so glad that you can use us as a resource to help. Again, that was the whole idea behind putting this show together, was to get resources out there and connect folks together. And so it's great when a plan works out the way you want it to, right?
Yeah,
Don't you love that?
it's nice, yeah.
So wonderful.
Exactly. And I want to share a couple of new opportunities, and I want to share some things that I want to share a success story of something that happened this past week. So,
great.
So you can end with our positive today, right?
Yes, we love that.
We love that.
So we encourage people to go online to the Want to Help line. It's at the City of Farmington, and you can access it by going to the city's webpage, City of Farmington, fmtn.org, and then clicking on coronavirus information, and you'll find the Want to Help line information there. Our phone number is 566-4210. There are 3 people who are working on this, and we are working behind the scenes to add more opportunities to find out what needs are and share those as we become aware of them. A couple of things from Basin Home Health have been recently added. Not only are the mask makers continuing, but surgical caps are being asked for both by Basin and for San Juan Regional. And San Juan Regional has a great video tutorial directions on their website. So we've got links to that, so you can find out what they need and how to go about doing that, contact people, information, how to drop off donations at the hospital, where to go, that sort of thing. So Basin Home Health is also looking for volunteers to support both client and clinician needs. So if that's something that you have a little more time and that interests you, please reach out to the contact information. It's Natasha Moffett that is on our website on the Want to Help line.
Very good. And this is constantly, you're adding things to that list, aren't you, Liesl, as word comes in of other needs in the community, and maybe other needs fall off the list, but other new ones come back on the list. This is something to keep track of, correct?
That's exactly right. And I will tell you, well, so on that, we have one that we learned of on Friday that we don't have full details on yet. What we learned on Friday is about the Navajo Hopi COVID-19 Relief Fund, and there was an article in the Navajo Times today about this effort, and they are getting food and looking for refrigeration until the food can be distributed. So they reached out to us on Friday. We don't have that up on the spreadsheet yet, and we're going to call back to them today because the message on Friday was we're good through the weekend, but we know we're going to have needs coming up. So part of my message is that if you are a organization that needs volunteers, please call that helpline number, 566-4210. And let us know if your needs have changed, if the information that we have for you is no longer accurate on here, or if there's something else. You know, we're being proactive in monitoring websites, in looking at Facebook pages, but if we don't have the accurate information, we want to, and we want to continue to address needs as they evolve. And then my success story to share is because several someones called the helpline. You know, they may have gone online and looked at what was there, but they said, I'm just going to call the helpline and let them know that I'm available to help. So this past week, we got word from Northwest New Mexico seniors that they needed a couple of people to deliver emergency materials, to actually pick up and get materials and take them to seniors' houses. You know, of course, things that can be done, practicing social distancing, that are essential services. And so we called back to people who had called in before and quickly found 2 people who said, yes, I'd be delighted to do that. And so we referred them back to Northwest New Mexico seniors, and they had their need taken care of.
Oh, great.
So even if you have read everything on the website and you think, okay, there's nothing there right now that I can do. I'm kind of already doing these things, but I have time. I have availability, and I want them to know that I have availability. Please call us, and then we will record your call, and as needs to continue to develop, if we have something like that happen again, we then have some people that we can call back to.
Great advice, Liesl. Thank you.
So can we just quickly return back to the Navajo Hopi food thing?
The refrigeration.
Yes, the refrigeration was
refrigeration truck.
Yes, I was like, wait, what? So they're looking for
a refrigeration truck.
Okay.
To store food.
Okay.
Yeah.
Okay.
All
right.
Or refrigerators.
Okay. Okay. So we could like donate a refrigerator we have around or something like that.
Exactly.
Okay.
Well, and I think they are still working that out. What is it exactly that we need? The information that we got on Friday was that they're looking for anyone that can refrigerate food as it comes in and hold it until it can be distributed. So if that's something that you have some connection or resources to, call us today at 566-4210. I feel like a radio.
No. Yeah,
That's
you do.
You got it.
Yeah.
You love it.
Well, there we are. Yeah.
Someone has trained you well, Liesl Dees, in the world of radio. So
wonder who.
There you go.
That's right. Well, this is great news, Liesl Dees. Thank you for calling in to share these positive things and other ways that I know folks, there's a lot of folks maybe sitting around, as you mentioned, with more time on their hands than maybe usually, or maybe something for even younger people to do. I would assume maybe there are some jobs for maybe some teenagers. Is that possible, or do you have to be over 18?
I think it's going to depend on individual things.
Okay.
And,
so you never know.
There are some things that I think Echo Food Bank has taken volunteers under 18. Correct, Megan?
Yeah.
Yeah.
Okay. Perhaps unofficially.
Okay.
Yeah.
That sounds great. And in asking that is exactly the kind of information that we want to get nailed down. The information that we have from their website doesn't say anything about that last time I checked, but we know those things change, and so the best information, just like you all want to do, we can get out. Again, if you're an agency, if you're an organization using volunteers, please call us and 566-4210, and we would love to make sure we've got information that's accurate and up to date for people who are calling in.
Perfect. Well, again, a great example, Liesl, of our community coming together. Again, San Juan College, City of Farmington, the United Way. What a great partnership. So thank you for sharing that.
And Scott, just two things I wanted to add here. One is that most people may have seen, many people may have seen a popular social media post going around saying we're not all in the same boat, that we are all experiencing this event differently. For some people it's quiet and calm and they're working from home and life hasn't changed. For other people, it has changed dramatically, and there are needs and concerns. And, we know that not everyone is going to hop out and go volunteer. We don't want everyone going out, right? We're supposed to stay at home. But there are essential services, and there are things that people may need at this time that perhaps you are the one whose boat is steady enough that you can help on something.
That's a great way to put that, Liesl Dees, as always. So, yeah, great.
And I was going to leave you with a song. Can I do that, Scott?
Yes, please. Especially if it's what I think it is.
Oh, well,
it is.
Okay.
Yes.
Like many people, my household enjoys music from live streaming that comes from artists. So there's a folk punk band that is called AJJ.
How does that work? Oh my goodness!
Scott has a very quizzical face on right now.
Yeah, you just blew my mind.
Maybe I should play it on Saturday, Scott.
Maybe. Okay, I'm with you. Now you've got me. You had me at
folk punk.
And folk.
So in a house concert this past week, we had a throwback to our preschool days when he started singing. The less we get together, the less we get together, the healthier we'll be. And then my favorite part is, because your friends are my friends and my friends are your friends, the less we get together, the healthier we'll be.
Wow. We need to just acknowledge Liesel's courage right now, I think.
I know. And I don't know how many copyright hits we're going to get from that, Liesel, please. But
you're going to shut us down, Liesel.
I can't wait.
Wow. Yeah. Man.
Thank you for sharing
Truly
that.
a public service right there.
I believe so.
Yeah.
There you go.
And if we made you laugh and made your day a little brighter, there you go.
Yeah. AFF, you said, right?
AJJ.
AJJ, okay.
That's something completely different.
Yeah,
don't search for that. Thank you, Liesel.
Megan, appreciate you guys. Take care.
Thanks for calling in, Liesel Tees.
Yeah, thanks for pointing out,
College.
Scott. It's just working a little slower this
That's
morning.
okay.
The brain.
It's all right. I want to just let folks know what.
AJJ.
There you go.
Maybe that's the nexus between punk and folk.
That could be it.
Yeah.
You never know, but there you are. But terrific, wonderful. And again, this is why we do this show Monday through Thursday at 9 a.m. And again, we appreciate folks that call in and contribute. Jeff Bourgeois, Liesel Dees. We've got more folks lined up the rest of the week. And so again, tomorrow we're going to be talking about this great, again, another cooperative effort, San Juan College, PESCO, the Big Idea Makerspace here at San Juan College, talking about creating, again, that personal protective gear. And so we're going to be talking with some of those folks. So again, it's going to be great inspirational stories about people pulling together,
It really is inspirational stuff. Yeah. Getting creative.
Exactly. So I think
out on the rough seas.
That's right.
I'll save the history of the 6 feet thing till tomorrow. So stay tuned.
Okay. Well, there you go, everybody. So I think we're going to wrap up the show today.
Yep.
And we appreciate you being with us, everyone. Again, please share. This is on Facebook. It's on YouTube. Again, you can hear it on the radio at KNMI every Monday through Thursday at noon, on KSJE every Monday through Thursday at 5:06 p.m. So we appreciate our radio partners to spread the word about local information during these times. Thank you very much, everyone. Stay safe and stay well. We will see you back here tomorrow, 9 a.m.